time when you have nasal blockage, excruciating pain, that gloominess about the sickness, you could have really have done anything to get rid of this. Of course, you could have gone to the doctors, but what if doctors were not available at that time? Suppose you have this in the middle of the night or during a festive or a vacation, or suppose you just don't want to go to the doctor for this thing. In that case, my friend, you will require some tips to manage these symptoms at home all by yourself. And this is what I'm going to tell you today in this video. Today, my friends, I'm going to tell you how to manage your issues of sinusitis at home without help of any doctor or anyone else. Now, statistically seeing, this condition is quite common. Every person will get at least 2 to 3 episodes of sinusitis in a year. And if that's the case, I don't think you should miss this video. So, stay focused, watch till the end. Hello friends and welcome to your YouTube channel, My Expert Doctor. I am Dr. Shalini Singh Salunke, your consultant physician. Through this channel, we are trying to provide you health-related authentic information. Now in today's world, getting information is a lot more easier than even getting fresh air. But if it's about your health, you should only trust expert and follow their instructions for a healthy and safe future. And this you can do by subscribing this channel and hitting the bell icon so that you will not miss any crucial health-related information. After all, health is our most valued asset, right? So let's start today's video. So let's first understand what are sinuses. To the skull, your skull or your head is not solid from inside, it's hollow. It's hollow around forehead, it's hollow behind your cheekbones and between your eyes. These hollows are called as sinuses. Now, why sinuses are required in our body? Their function is to keep the skull light. Because they are filled with air, the sinuses make your skull light so that you won't feel heavy on your neck. The second function is to secrete mucus, which is a sticky liquid. The mucus is required to trap the dirt, viruses and bacteria which enter into our body while we are breathing in through our nostrils. So it's sort of defense mechanism of our body. The third important function of sinus is it acts as a personal humidifier and space heater for the air you are breathing in. So that cold, chilling air will not enter your system and harm it. So you see how important sinuses are. In normal scenario, your sinuses are filled up with air and a little bit of mucus. Now, because of any reason, if there is a nose block or your sinuses are blocked, the mucus keeps on building inside and will put pressure over your skull bone, which will lead to heaviness, headache and stuffiness. And this, my dear friend, is known as sinusitis. So sinusitis happens because of the inflammatory changes which happens in your sinuses, which leads to excessive production of mucus, and this mucus remains trapped inside the sinuses, leading to all the symptoms. Now, there are two kinds of sinusitis. One is acute, another is chronic. So if you have symptoms of sinusitis around 2 to 4 weeks, then it is called acute sinusitis. If the symptoms last for more than 12 weeks, it's called chronic sinusitis. It's that simple as that. And if you are having episodes of sinuses more than 4 or 5 in a year, that's called recurrent sinusitis. So remember when I told you that sinusitis happens because of blockage of sinuses? So let's explore the causes of blockage of sinuses or indirectly sinusitis. Number 1 is common cold. Number 2, any kind of allergies, let it be dirt allergy, dust allergy, mites allergy, any kind of allergy, or allergy to cold, or allergy to change in temperature. Third is small growth in the nose like polyp or something. And then fourth is a deviated nasal septum, that is your nose is not straight, it's probably crooked at right end or left side. That's called DNS or deviated nasal septum. These can be the causes of sinusitis. Now we have understood what is sinusitis, how it is caused. Let's move on to how does it present. How will you come to know that you have sinusitis episodes? Number 1 is facial pain or pressure that you feel around your cheekbone and your forehead. Number 2 is stuffed up nose. Number 3, runny nose. Number 4, loss of smell or foul smell. Number 5, cough or congestion. Number 6, yellow greenish nasal discharge. Now this yellow greenish nasal discharges might be because of the bacterial contamination which happens because of trapped mucus inside your sinuses. Then you might have fever, bad breath, fatigue and tooth pain. These can also be the symptoms suggesting sinusitis. Now we should move on to how to manage it at home. Why is it important to understand these tips? Because number 1, these are very common complaints for which every time going to a doctor or seeking help doesn't make sense. Number two, most of the treatment which even a doctor is going to tell you is conservative one, which you can any which ways try at home. Thirdly, when you have these kind of symptoms, there might be times when these things happen in the middle of the night or in the early morning, and it's not feasible for you to reach out to a doctor. And for instant relief or immediate relief, these tips will come very handy. So the first thing is taking steam. Steam is magical in the case of sinusitis. You can take plain water steam. You have to take it at least thrice to 4 times a day, and each lasting for 3 to 5 minutes. Followed by steam, you must do a sinus massage. Now, sinus massage, as I am showing you in these pictures, is very important. You have to just pressurize a point from from your forehead towards your nose, from your cheekbone towards your nose, and from the point where your nose starts towards the middle part of the nose. This is how you are basically, with this pressure, you are trying to move the mucus in the direction of nose, so that either you can blow it out or you can take it in. Sinus massage and steam are basically the most important treatment for acute sinusitis or chronic sinusitis. Then you have to keep your hydration status perfect up to the mark, because if you are not hydrated well, your mucus will start becoming thicker and thicker, and that will cause a lot of congestion and problem. The pain will also worsen. So keep yourself well hydrated. Then you can also use saline nasal drops to keep the mucosa of your nose moisturized. Then you can also use warm compression over the areas where you're experiencing pain, mostly over the forehead, around the cheekbones. You can use warm compression. That comes very handy. Basically, it acts as a painkiller. Then sometimes, in some cases, if you have chronic sinusitis, your doctors might advise you to take steroid treatment, which would be mostly intranasal. Also, while sleeping, you should keep around 2 to 3 pillows under your neck, so that you're not lying flat and it is easier for you to breathe in. Then you have to avoid movement in sudden change in temperature. That is, suppose if you are sitting in an office where you are having AC and the temperature is around 16-17, you should avoid moving out in the warm or hot weather or sunny weather conditions, because in cases of sudden change in temperature, the problem of sinusitis exaggerate. Apart from all these things, you can also try turmeric milk, ginger tea, because these will keep your body warm from inside, which is very important. Now, suppose you have been trying these things for like 2-3 days and you're not getting symptomatic relief. This is the time, my friends, when you have to go to a doctor and take advice from them and follow it properly. Now, how can you prevent sinusitis attacks? Acute sinusitis is okay. You don't have to worry much about that. It happens once or twice in a year. But those who have chronic sinusitis, they have to avoid smoking permanently, active and passive both. They have to wash their hands very frequently, specifically before touching their nasal part. And third, they have to identify the allergy causing agents, because that way they can stay away from them and avoid chronic sinusitis as much as possible. So I hope you have liked this video. You have understood how will you take care of sinusitis at home without help of anyone else or either doctors. If you like this information, please hit the like button and also share it with your friends and family. With similar informational video, we'll meet again. Till then, namaste.